Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Dr. Gregory Brophey, and we're going to be talking about a new type of surgery that he offers. It's a laser-assisted cataract surgery. Hello, Dr. Brophey. Thank you so much for joining me today.
Thanks, Jill. It's great to be here.
And I know you've been on the show before, but a little bit of introduction. And maybe in the introduction, talk about what you do in your office before we get into your exciting new surgery?
Absolutely. Yeah, I've been on staff here at NMC for about 10 years, so since 2008. I'm a board-certified ophthalmologist, and ophthalmology is really the medical and surgical care of the eye. And we really take care of patients through all parts of the healthcare continuum. I deal with patients that have diabetes that need diabetic yearly eye exams. I see patients for specific eye problems like glaucoma, macular degeneration, people with problems with their eyelids, people with poor vision from cataract. So it's a really nice variety of things for me, and I think well suited to kind of my interest in kind of being a techie.
Wow, that's great. And you're not located on the hospital campus, right?
Correct. We have never been on the hospital campus. We did move from our previous location at the end of 2017. We moved to a larger facility, which is actually at 128 Fisher Pond Road, so we're on the second level of that building above the Northern Valley Eye Care practice, and that's the practice of Dr. Steve St. Marie and Dr. Carl Cunningham. So it's really good to actually be located so closely to their practice because we share in the care of many or multiple complex patients. So it's nice to have that proximity to their practice.
Yeah, that's really ideal. All right, so our feature of this presentation is really about laser-assisted cataract surgery. So can you tell us about that?
Absolutely. Cataract surgery has benefited substantially over decades from technology, and really kind of the same advance in technology that we saw with LASIK surgery, with laser surgery to reliably and predictably and reproducibly fix someone's vision, has been an application in cataract surgery now for some time. When patients come in to have their cataracts evaluated, or if they just come in with blurry vision and they're told they have a cataract, we always start with an assessment of what the patient's visual requirements are. Typically, cataract surgery can be done, it's always done in the surgical setting, and traditional cataract surgery is done using scalpels by making incisions through the cornea. There's also a manual process we do called capsulorhexis, which is the creation of a circular opening in the front part of the lens. And then there's a manual ultrasound-guided dissection or disassembly of the lens, the cataract inside the eye. And so that's typically done by the surgeon, all three of those steps. And those are all very critical steps in helping the patient achieve a desired visual outcome. Laser-assisted cataract surgery, or laser cataract surgery, uses a laser beam, a femtosecond laser. And it's a very, very brief pulse of energy that's applied to tissue to break apart chemical bonds within tissue. And so essentially that automates a lot of the more manual processes that a cataract surgeon would do. I can show you, I have a video here that I can cue up for you, and this is basically just an animation. Here you can see the laser beams being applied to different parts of the eye. In this case, the laser is applied to the main corneal incision during cataract surgery. The reason this is called a femtosecond laser is that a femtosecond is actually 10 to the minus 15th of a second. So that's 1/1,000,000th of a billionth of a second.
Wow.
And there's actually
crazy.
thousands of these laser spots applied in any 1 second during surgery. And here in super slow motion, you can see these lasers being applied, in this case, to the cornea. Wow. What happens, the laser disrupts chemical bonds and it creates plasma within tissue. And you can see that happening right here. As plasma is created, it creates a gas bubble, a cavitation bubble, and that actually separates tissue. And so in placing these laser incisions at specific locations inside the eye, we can perform very precise dissection, and that's very reproducible. They can be done at different depths, at different parts of the eye, and through different tissues to create desired outcomes. So in this case, it takes about 30 seconds for the laser to make all of these incisions in the eye that normally I would be doing manually.
Wow. And so, is the eyesight better, or what's the benefit, would you say?
That's a great question. I really, when I begin surgical discussion with patients, it's really, we really use as a foundation what their visual needs are. And I listen carefully to what their expectations are after surgery. Some people are offered traditional cataract surgery, frankly, because they may not be a candidate for laser surgery for a variety of different reasons. Certain refractive surgeries the patients may have had in the past, certain types of glaucoma, corneal scarring that could prohibit the laser from penetrating into the eye. Those patients are not good candidates. Furthermore, laser surgery is not typically included as a covered benefit through Medicare or private health insurance plans. It is an upcharge. Insurance still covers a portion of that. But typically, I start any discussion with a sense of how the patient wants to see. Traditional cataract surgery is a good option for patients who don't mind wearing glasses after surgery. I have a lot of patients, you'd be surprised, who say, you know what, I frankly would rather wear glasses. I've worn them my whole life. So in that case, traditional cataract surgery is the way to go for that patient.
Okay.
Patients who do not opt for laser cataract surgery should still feel very confident in traditional cataract surgery. It's 4 million cataract surgeries are done every year in the United States, and it's one of the most successful surgeries that are offered out there in the medical world. For patients who are opting for less glasses dependence, say for distance vision to correct astigmatism or to help reduce their dependency on reading glasses for small print, laser can be a very attractive alternative, or addition, I should say, to cataract surgery, because again, it takes some of the more challenging parts of cataract surgery out of my hands, and a laser reproducibly is able to assist in some of the very critical stages of cataract surgery.
How fascinating.
Yeah.
That this is. So is this a new procedure, a new procedure, or where are we at with that?
Laser cataract surgery has been FDA approved since 2011, and prior to that, the femtosecond laser was used with LASIK surgery for many years, so it's not new.
Okay, great. So I know that a lot of people struggle with their eyesight, and they maybe not know quite what to do with it, or they may just sort of deal with it on their own. What do you suggest for them?
I think a lot of people sometimes feel anxious about surgery on the eye, and I think in all my years of practice, I've felt there's no real good way for some people that are afraid of coming into the doctor to learn about what's wrong with their vision, other than just kind of getting in there and doing it. So I would encourage anyone who is curious or bothered by their vision in any way to make an appointment with their eye doctor to discuss what is wrong with their eye. And if cataract surgery is determined to be something that would benefit from them, then I think the patient is able to make an informed decision based upon all of the options that are available to them now. And I think there's more options available to them now than there ever have been before.
Now, in doing this surgery, does it take special training to do this, or? It
does. There's a training program that surgeons need to do, and there's a certain number of cases that need to be signed off on. And really, I always joke with our technicians about this. This is kind of making a lot of the things that I trained for in residency. This is automating some of those things that took many, many years to hone and develop. So this is really the easy part of the training for me. But yes, the laser, there are a couple of aspects of that need to be mastered. Absolutely.
Well, I really appreciate the fact that you continue to progress in your practice. You've got a very busy practice, and having these options for the patients, you're always so centered on what's best for the patient, and I appreciate that greatly.
Well, thank you. I try to be. A lot of our patients spend a part of their year elsewhere. They leave Vermont in the winter, they go to Florida. I think this is more, laser cataract surgery is probably a little more common in areas like that, and so I find a lot of my patients coming back asking me if I do this procedure has been part of the reason why I have moved over to offer the technology.
Okay.
So I really do think the patients are the primary driver behind the shift in the technology and offering this treatment option for patients.
That's terrific. Now, you not only have a busy practice, but you've taken on other responsibilities at the hospital.
I have.
Yeah. Yes. So you're very busy. So maybe tell tell our viewers maybe some of the other things that you're doing.
I'd be happy to.
You're so involved.
Absolutely. I'm the Executive Medical Director of Physician Services here at the hospital, so I have kind of a direct oversight function over our providers in outpatient clinics, of which we have a growing number of them here at NMC now. So that's actually been a really great way to get to know my colleagues, my referring colleagues very, very well. And I've developed a lot of close relationships with the people here on our medical staff because of that. So that's actually been a very nice thing. In addition, I've been working with Joel Berry and his team in implementation of our new Meditech electronic medical record system. And that work has been taking about a year for us, and we're almost ready to go live on our new EMR. So those are a couple of things that occupy myself outside of my full-time ophthalmology practice.
So in hearing all of that, because you continue to grow and get involved and to lead, and it's really impressive. And so what do you do for fun to balance this? You always have a good spirit about you too. Your patients love you, and so how do you make it all work?
I don't know. I really think a lot of the drive comes from just an enjoyment out of what I do. And I think, helping patients see better, improving their vision, and being able to do that so instantaneously for patients has been, I think, the single biggest driver in my desire to keep doing this. And of course, balancing it with outside activities also is very critical, I think, not just for me, but for everybody.
And I worry about that, and I know we all do, is that there is so much going on in healthcare. I mean,
yes.
New technology. I mean, new techniques. So you're staying abreast of that to offer the best and the latest to our patients. You just described also this major one-year project for integrating our healthcare systems, our electronic health record, and getting that access on your phone for the patients. And so just trying to stay ahead is really exhausting. And what physicians want to do, what providers want to do, is provide great care for the patients. So you're involved in a lot of things that may take you away from the patient, but I'm hoping in the end it will benefit you, your patients, and keep you healthy. Because I worry about folks being so busy that we want to make sure that you're healthy and happy on and off the job.
Oh, that's very true. I think at NMC we've taken, and you know this, we've taken really an interest in wellness of our providers, and I think we've tried to give our providers as much seat at the table in the decision-making process as we can.
Yeah.
That goes we've got a lot of physician engagement in our new EMR. We have physician engagement in our clinics and how we schedule and interact with our patients in that fashion. So I really do think it's a really collaborative environment where physicians can be happy and can provide the best care for patients. I think that's one of the things that makes our hospital so great.
Well, thank you for that, but it's really this the relationship that really matters with you, your patients, the community, but also with us, so that we can make it all work, because just acknowledging there is so much going on. And I really appreciate you, your leadership, the care that you're giving to the patients, your involvement in making it a better place and better access to care. So I'm grateful for that, and for all of our providers, but you're certainly a leader that stands out.
Oh, thank you.
So thank you for that.
My pleasure.
Now, before our time is up, is there anything else that you wanted to capture about this surgery, about your practice, that you think would be helpful for our community to know?
Yeah, I think it's really just important for patients to think carefully about what they want from their cataract surgery. If cataract surgery is something that will be on the horizon for them, I challenge patients to think about, in an ideal world, how would you like to see? Would you like to not have to wear glasses when you're driving? Would you like to not have to wear glasses when you're in your car looking at your car dashboard? You want to be less dependent on glasses on your cell phone? Those are questions I think that you really need to come to the table with some thought in mind about. And if a patient doesn't know these things at the time of their visit, I invite them to think about it and call me back. It could be that for the majority of patients, traditional cataract surgery is the way to go, and they're happy wearing glasses after surgery. I really want to say I enforce that, and I think that's a great option for the patient. But for those patients who might want a little bit more from their surgery, just to know that there are other options out there, I think is a good thing.
That's terrific. Thank you for joining me today. It's
My
been
pleasure.
It's been great information. It's great learning for me as well, and I love the video, and so So, boy, I can't thank you enough. That skill set is pretty amazing. So thank you.
Thank you.
I'm Jill Berry Bowen, CEO of Northwestern Medical Center, your host of the Health Beat Show. And, I want to make sure, and as Dr. Brophey has stressed, is that we want you to be involved in your care. And the fact when Dr. Brophey said, I want the patient to come in and have a conversation, what is it that you want? What is your best self? And how can we help you get there? And giving you information so you can make informed decisions versus us telling you. And I think that will certainly improve your quality of life and certainly being involved in your own health and that decision making. So thank you for joining us today.